Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward here with another health ministry update. I'd like to start by saying thank you for all of those who joined us with our free drive-through COVID-19 testing. It was done yesterday on the church parking lot. It was hosted by us, but it was done by Mahari volunteers. We thank the Boy Scouts as well for helping us to set up. And we thank those of you who joined us on Facebook Live for our presentation, Be Kind to Your Mind, Coping Mechanisms for COVID-19, that was moderated by our own Lauren Freeman. We also appreciate all of those speakers, including our own Deacon McKinney. Want to talk about our children for just a moment, since we're in this quandary about to school or not to school. And I am not here to tell you whether to send your children to school or not, just basically to give you information that may or hopefully help you make better decisions. Children do not get infected with coronavirus as much as older individuals, especially children under the age of 10. And when they do, it's usually not as severe an illness as you would see in older individuals. That can be good and it can be bad. It means that they may be asymptomatic or they may not be very sick and they can still be positive. That means that they can transfer or transmit the illness to others who may be more vulnerable. And that can include an older sibling with asthma, a parent, a grandparent, a principal, a teacher, a bus driver, a cafeteria worker, or someone in environmental services. Any number of people can be affected. So when we protect our children, we actually protect each other and ourselves. So that's one real consideration. The other is that in order to keep the children safe, we really need to have certain protocols in place. And I understand that we are considering certain protocols when we make these decisions. So just be mindful of the things that are planned and how they plan to keep the children safe as a school board and as government officials. You know that there will need to be fewer children in the classroom. There will need to be fewer children in the cafeteria at one time, in the bathrooms. Playing together will be different. Everything's going to look a little differently, and we just want to make sure that we're doing our best to keep our children safe, because that in turn keeps us safe also. So the next thing I want to mention is that a vaccine was announced in its third human trial. It's not available at this point, but progressing very well, and this was from Oxford. We think that the progression has occurred as quickly as it has because we are familiar with the coronavirus family and its genetic makeup. So we didn't start from scratch there. The other thing is that we are familiar with making vaccines for viruses. So we didn't start from scratch there either. So there are a couple of things that have helped us get a little further along than we probably would be ordinarily had we not so much information when they first started working on the vaccines. Again, this is not to say to take it or not to take it, but giving you information about the progress and what's happening. Finally, on July 17th, the CDC revised its stance on when we are considered no longer contagious after you've been diagnosed with COVID-19. If you have mild disease with COVID-19, then 10 days from when you were diagnosed or when you are symptom-free, and no fever for 24 hours without Tylenol, you are considered no longer contagious. So, for those of you who may have contracted the illness, you can consider yourself no longer contagious and may move around in the house with your family and outside of your home with others. If it's been 10 days, if you have no fever without Tylenol, and you are symptom free. Um, Finally, let me just say we are in the middle of a terrible surge. Tennessee is not at the top of the list, but we're not far behind either. Um, we need to do all that we can to mitigate this disease or slow the spread, and that includes wearing masks and physical distance of at least 6 feet. It means both of those things. And we need to continue to wash our hands, cover our cough, um, do all the things that we know that help to slow the spread of the disease so that we don't have to do a shutdown. That's the only thing that we have right now to help us get past this. And it's going to take all of us to be responsible for all of us. At any rate, I usually end this by saying be safe, be healthy, and stay prayed up. I want to just emphasize stay prayed up. This is a time when we need to pray for every leader in every corner of our lives, at home, at church, at work, wherever, especially in our government. So join me in that stay prayed up because we need it right now more than ever. Have a blessed week, and thanks for joining me.